So we're going to have some fun after lunch. We're not going to let you fall asleep because you ate, too much good food. So Dr. Alana Sterkel is going to take us through a fun game of Kahoot. So there is a prize to the winner. So everybody go ahead and do your best to come out on top.
All right, so if you have not played a Kahoot game before, it's pretty straightforward. Look for it on your cell phone. You can either Google kahoot.it or you can scan that QR code. If your phone's not doing well from a distance, feel free to walk up to the screen if you need to. If you do go through Google, you just enter in that PIN number on there. If you're having troubles connecting, that PIN number will stay at the bottom throughout the entire game, so you can go back and rejoin as needed. You do not need to use your real name. We can keep this anonymous. It's kind of fun with this, that your record, only you will know your results until the end. We'll ask the first place winner to de-identify themselves so that they can get their prize and get some recognition. The questions for this are meant to be key highlights from today's presentations, some key takeaways for public health things that we couldn't quite fit into their own presentations, some biosafety topics. If you have been reading our surveillance booklets and our regular lab messages that come out, you should be able to compete pretty aggressively in this. And if you're having connection issues with Wi-Fi, do we have a Wi-Fi password?
It's on the table.
On the table. Perfect. So if you need Wi-Fi help, you've got something there too. So how this game works is that questions will come up. First it'll show the question, and then it'll give you some answers that come up afterwards, which will coordinate two buttons on your phone. So pick the button that coordinates the answer you want to choose. The faster you answer, the more points you get. So fast fingers count. And the more correct answers you get in a row, the more points you get. And you can be on fire if you get streaks of 3 or more. We're going to practice this first with a question everyone will get points for. I do want to note that these questions are on a timer, so you've got a max of 20 seconds to answer. But if everyone gets their answer in quicker, then we can move on to the next question. So please try to answer for everything, otherwise we just sit there and watch the timer at the end. Okay. So we will get little updates between each question about who's in the lead as well. So it makes it a lot of fun, and then whoever wins has bragging rights. So I'm going to go ahead and start. The first one is a poll, so there's no wrong answer, but just to get you warmed up for this. One last call. Is anybody having challenges and needs me to wait another minute? All right, like I said, that pin will stay at the bottom if you still need to connect. All right, we're going to start with that poll. Wonderful. Okay, so we've got 68% of us are clinical laboratorians, 5% infection preventionists, and 27% public health. So we get a nice breakdown of our different group here. All right, now the real questions start. Are your fingers ready? Is everyone connected? Let's go. Oh, answers are coming in fast. Waiting on somebody. Wonderful. Good job, everyone. The Plesium monoshigaloids is no longer being requested for surveillance, but we have added Chronobacter and Blastomyces, and then Legionella has always been requested, but it's now in the booklet. Good job, everyone. And after first question, the mighty fuzz comes in first. All right, so Erin did a great job going through this. So even if you're not a laboratorian, we did talk about having those early indicators to move into a BSc and perform rule-out testing for our slow-growing organisms, particularly ones that are slow-growing and not growing on McConkey, even though they're gram-negative and gram-negative coccobacilli by our gram stain. I know that's a tiny image, but those are coccobacilli. Mighty Fuzz is still in the lead. Well done, well done. So although we did not cover a lot of packaging and shipping stuff today, we were very, very lucky to get some APHL funds this year to do packaging and shipping training for Category B. So if you were able to join us for these trainings, wonderful. If you were not able to, we did record a lot of this. Thanks for Jim's help on that. And so it's available on our website along with some handouts to help remind you on best practices for Category B training. We hope to offer that again in the future, but it depends on funding. Shimra comes in first, and 30 players have an answer streak, so a lot of people are doing well. Here's just a quick picture of that biological substance Category B and the UN 3373 diamond. Just a reminder, if that word does come along the side, that always needs to be in a diamond format, not a square. Yes, there are reactions too, so have some fun with those. Sorry for those who don't like Star Wars. I had to stick with the theme at least a little bit. At least 28 of you have watched the recent Mandalorian movies. It is Grogu is Baby Yoda's real name, although I really want him to just be Yoda. Shimra's still in the first, but Giardia is coming in fast. Good job. This stumped a few people. Next year for this regional meeting, I hope to see you all there again next year, for our 30th anniversary of the WCLN. The Wisconsin Clinical Lab Network first started with a virology connection for people who were trying to do viral cultures, and those techniques were so challenging. We relied on each other to share best practices, and then that morphed into the Mycobacteriology Laboratory Network. And then after the 2001 anthrax attacks, and we got some CDC funding for the LRN kind of emergency preparedness, we were able to take that and build this Wisconsin Clinical Lab Network. And it's unlike any other network in the country. The strength that we have for continuing education, for these kinds of fun activities, and to provide this kind of information to you is really something quite unique, and certainly something that we're very proud of here in Wisconsin. Mocha comes in first. Oh, you guys were fast on that one. Well done. All of the above. So Al gave some great presentation details about how this surveillance data helps us to recognize our outbreaks, inform on vaccine development, give us trends to help us both in the clinical laboratories and for patient care. And of course, he also spent some great time talking about the unintended wonderful side effect of helping us to evaluate test performance as well. But I ran out of spots to put things. Mocha's still in the lead. Not too much change on that one. Quite a few people still have streaks. Now, this one's a little bit tough. So we did present this at our technical conference earlier this year. and mentioned it briefly at our regional conference last year as well. So this one is causing some disruption in the field. Anytime we have these name changes, it is challenging in the clinical laboratory. A lot of this is coming as we're learning more, we're sequencing more, we're looking at the biochemical and relatedness of organisms more, and so we are seeing these name changes come through, but we look at how are we isolating them in the lab, how are patients being treated when physicians are trying to recognize these names. There are some challenges. This one was a particular challenge because previously the genus Brucella was only for select agents, right? The Brucella, formerly known as Ochrebactrum, is not a select agent. And this is still a challenge to identify on your MALDI-TOF. So if you were to get a Brucella anthrope on your MALDI, it might not necessarily give the appropriate ID, and getting a Brucella anthrope ID on your MALDI might not necessarily mean it's not a select agent. So please keep this in mind as you're looking through these, and keep those rule-out tests in your mind as you go through this too. Aggie is coming in first, and the mighty fuzz is close behind. And this one's a little bit of a tough one. This really could be its own talk. And honestly, we're seeing tons of webinars come out about this as we try to figure out and navigate the new FDA rule on lab-developed tests. Unfortunately, we don't have a lot of time to talk about that today, but look for more guidance as we learn more about this and put things out there. As things are currently written, if things don't get held up in litigation or otherwise, if you are currently looking to bring on a new lab-developed test, you would need to submit it for FDA approval or stop that testing by November 6th, 2027. And here's a little bit of a closer, I don't know how well you guys can see that, but this is just kind of looking in that time frame of we need to be able to report that we have these LDTs that already existed prior to the May 6th ruling. We can still run them through this time frame, but if we want to continue running them after November 6th, we have to submit for some level of de novo or 510K approval. Ooh, another tough one. So this has been an evolving situation and hard to keep up with. We have been trying to keep you guys up to date with this in our lab messages, and we have a web page devoted to Mpox right now to kind of help you through this part. So originally, monkeypox, which is now called Mpox, was all considered a select agent. And after that really large outbreak that we had last year between men who have sex with men largely, that Clade 2 outbreak, the Clade 2 was de-escalated out of the select agent rules since then. Clade 1 is still considered a select agent. If you are also doing testing in-house and only get monkeypox but don't have Clade ID, because you can't rule out Clade 1, that is also considered a select agent and would require Form 4 reporting to the federal select agent program. At the Wisconsin State Lab, we're currently performing the non-variola orthopox test, since that is not monkeypox specific, but likely monkeypox given an outbreak scenario. It's not a select agent, but does get you closer to the result. One last piece of information we recently came across was if you need diagnostic results on Clade 1, CDC is only offering these diagnostic results on dry swabs. So as you're thinking through, talking to your physicians, wet swab versus dry swab, we can test wet swabs at the state lab or dry swabs. So if you want to have them send one of each or both to dry, that's fine. But if you want that final Clade 1 ID from CDC, it needs to be a dry swab. All right. Where are we at now? Eggie is still in the lead, but Jabba the Hutt is coming in quickly. Well done. People were paying attention. Routine medical waste is not an appropriate way to destroy select agents, and Erin did a great job describing that. Aggie's still in the lead, but it could be anybody's race at this point, about halfway through. Yeah, so Oropouche virus is making a comeback, I guess, this year. We're seeing unusually high amounts of this rare virus in South America. This causes a disease very similar to Zika virus. It can cause microcephaly in infants if the mother's infected during pregnancy. So something that we're certainly watching for and keeping an eye out for. While there are an increase in cases that we've seen this year, it's still by far being outweighed by dengue. So in those areas, really being thoughtful about what samples you want to send for testing. Because this testing is really only available through the CDC. It is being policed fairly closely on who can get this testing. Not everyone coming in with symptoms can get this, so you do need to get approval from DHS to do this testing prior to sending to us, and we'll forward on to the CDC for you. And we're also recommending that you recommend to your providers to do dengue testing first, and we can also help provide that. All right. Jabba the Hutt is in the lead. All right, so I kind of threw a curveball here. We used to request that you get approval from DHS prior to testing, and we just changed this. That we are seeing an extra ban a year for dengue, and I'll talk about that here in a moment. And so we removed this barrier to help improve access to testing. So it is available diagnostic testing for your patients. Jabba the Hutt still in the lead, but Roadrunner coming in fast. So like I mentioned, it is a big year for dengue. So we tend to see spikes in dengue every 4 years, but the spike in this year has been unprecedented compared to what we've seen for quite a while now. So unusually high year for dengue. We still offer testing at the state lab, IgM testing and PCR testing, and we do recommend you test both. When you have a suspect patient, any positives will be forwarded to the CDC for PRNT confirmation at no additional charge, and potentially some serotyping as well for surveillance purposes. And while this is now a fee-for-service test because we've removed all those barriers to getting the test, fee-exempt testing is still available for underserved populations and those who would not otherwise be able to get testing through routine means. You're talking about underinsured, uninsured, people who would not otherwise be able to get testing for a financial barrier, and that's available only on approval through DHS. All right, so another tough one. I think we've heard a lot. We had a great case study today about Francisella tularensis and a cat bite, and so this one was certainly on the backs of your minds, I'm thinking, as you're looking through this. And as we're looking through, one key thing to keep in mind is that is not a gram-negative coccobacillus. Those are actually pretty long, kind of curved, variable thickness gram negatives there, and this kind of variability can be seen in a couple of different organisms. And some key things that should have helped stand out to you is that because this was slow growing on chocolate and MAC negative, I mean, you should automatically be thinking about a select agent going through your rule outs. But if you pull out that wonderful rule out chart from APHL and go down this pathway, catalase positive, oxidase positive takes you down the Brucella pathway, but it was urease negative, which rules out Brucella. And so if we've ruled out our select agents, the next ones here are the ones that can have that weird morphology on gram stain. And Streptobacillus maniliformis, for those who know it, is rat bite fever and also has a very weird looking bacteria. But CAPNO means it's CO2 requirement, so it only grew in CO2, and canemorsis is from dog bites. So something to keep in mind. Not everything is a select agent when it's slow growing, so you want to do your rule outs, you want to get to those answers to help our patients. Jabba the Hutt is still in the lead, but it's anyone's game. And here's that flow chart just as we go through. I refer to this all the time. It's so incredibly helpful. Just keep it on a bench card or keep it on hand so you can very quickly go through and say no growth on MAC, catalase positive, oxidase positive, urease negative, and you can very quickly get through the answers that you need. Well done. Okay, so there's been a lot of cases of H5N1, but not in humans. Millions, hundreds of millions of cases in birds and cows and swine. They're all over the place, but fortunately we're not seeing a ton of cases in humans. And we know we're not seeing it because we have such a robust surveillance program. We'll talk about that here in a moment. So while we hear a lot about it, so far we're not seeing a lot of human cases. The mighty fuzz pulls back into the lead with Aggie close behind. Some real fast answers on that one. Yeah, this is an influenza A. It will test positive with a standard influenza A test. And so you still get that influenza diagnosis for your patient, but you can't tell if it's an H5N1 without doing additional characterization, which is available in the state lab. So the mighty fuzz still in the lead. Just go in a little bit more details. We are requesting a lot of samples for surveillance. Right now in the off season, we're asking for all flu A positives, anything unsubtypable in your lab. There's a lot of people who have molecular panels which will look for H5N1, things like that. H1N1, and then we can do additional typing. We're also looking for anyone who's had any animal exposures, particularly bovine, swine, or avian exposures. Lab-acquired infections, we're happy to take those too, and any recent international travel history. So we're monitoring for all kinds of weird influenza strains that might be coming through to help look for any H5 that might be circulating and other things. Well done, well done. So it's not that MRSA is not important, because it is. It's just not currently being considered an urgent threat. And we'll go through some details right after we check on who's in the lead. Mighty Fuzz is still doing quite well. So this was a little mini report after the big 2019 report. So this was looking at how did things change post-pandemic from that 2019 report. And it was looking at increases or decreases year to year of things that were considered either urgent threats or serious threats. So MRSA is still on the serious list, but it was either stable or decreasing for most of this time. You think we're doing a lot of testing. I mean, if you get a Staph aureus on a blood, you're testing for MRSA. There's a lot of screening for MRSA left and right, and those efforts are making a difference, that you are doing stuff day to day to help control the spread of MRSA. CRE, crab have had overall increases. Some are worse than others, and the really bad one is C. auris. It's over 500% increase sustained since the pandemic. So this is the one that we're really concerned about having really significant increases. The picture's a hint. So, this one stumped a lot of people because we talk so much about Listeria. But this was actually in your surveillance booklet with that picture, and Al mentioned it as well. This was the weird Salmonella Sundsvall that was a multi-state outbreak with cantaloupe. Well, we have had some cantaloupe Listeria outbreaks in the past as well. This was just, we don't expect you to memorize all the outbreaks, but this was just a little check to see if you were paying attention this morning. All right, Mighty Fuzz still in the lead. That stumped a lot of people. All right, now let's take a closer look at the majority still got it, over packaging. So while they did have, it's kind of tiny here, they did have a to and a from. They had the Cat B label in diamond format. This was a high pressure biohazard bag that they had here. You can see your sample. Now I can't see if there's absorbent material in there or there's no requisition form if they're sending to us. We certainly want those every time. They do have an ice pack and not wet ice. Please never send us wet ice. It just becomes a sample floating in a pool by the time it gets to us. What this one is really missing, though, is that over packaging. We're still thinking about patient confidentiality. You can see right through that bag into the sample, and so that patient information is potentially exposed to anybody who might come across that package. We're also thinking you want a nice hard-sided outer container to help contain this. It needs to be able to be resistant to breaking open if dropped from shoulder height. All right, where are we at? Jabba the Hutt coming in close. A little bit closer. I can tell by the giggles that some people really know their Star Wars and are a little horrified by some of these answers. Those who don't know, Luke and Leia are brother and sister. Vader and Leia are father and daughter. And Padme Amidala and Emperor Palpatine is just gross. So, Han Solo and Princess Leia are Kylo Ren's parents. Did anyone get thrown from that one? Yes, Jabba the Hutt pulled out that one. So Jabba knows his Star Wars genealogy. Yeah, well done, well done. So just for funsies, there's no extra points for this. Can they tell me what we're looking at in this picture? Koplik spots, yeah. So these little dots in the mouth, I mean, childhood rashes are a dime a dozen, right? So telling a measles apart from some of those other rashes can be difficult, and these little spots in the mouth can be really helpful. But in the end, you need a good diagnostic test. And so that's something that we can help support you with. We are capable of doing some pretty extensive measles testing at the state lab. Because we are one of those regional vaccine preventable disease sites, we have, not only do we have the measles diagnostic PCR and the IgG and IgM, which can help with the immune status kind of detection as well as acute infections. We are also one of the few labs that has a vaccine strain PCR as well. So your response for public health for a measles outbreak is to go out and vaccinate as many people as you can in the area. So you want to know, are they currently immune, or if they've just been vaccinated and they test and they develop symptoms and you do the PCR, the vaccine can make that diagnostic PCR positive. So you need to know, was it the vaccine that made them positive, was it wild type, or was it vaccine strain? So that other PCR can be really helpful in that investigation. Jabba the Hutt, still and strong. We still got a few questions left. This is our last question left. All right, so I think some people recognize the Nacasiomyces glabrata, formerly Candida glabrata, and the Mayoroszyma guillermondii, Candida guillermondii, that's pretty straightforward. Can anyone tell me what Pichia kudryavzevii? Candida krusei. So some of these are a little easier than others, and others are just bizarre. So they've been trying to push these names in the clinical field for nearly 10 years at this point. And the challenge is that these yeast have both a sexual and an asexual, a telomorph and an anamorph form. And so the more widely accepted names in the research fields, in the academic areas, are these telomorph names that you're seeing here, the Pichia and the Nacasiomyces. And so that's why they're trying to push us towards this. And what what we're seeing is that it's coming in our MALDI updates. So when you get an update to your library, you're seeing these names come in, and you're like, what the heck is that thing? It's a candida, but there's a challenge here as we're looking through how do you communicate that to your providers? How do you re-educate them on all of these different names? And the question comes in when you start to break, I know you can't see all the details. The point is that the diversity within the Candida group is pretty large, and it breaks out into a lot of different names. And re-educating all of our providers and all of these other names that could be used can be very, very difficult. And unfortunately, when you have unusual names reported, sometimes that gives undue significance to things that might not be that big of a deal, or sometimes they don't know what it is, they don't know how to treat it. They might throw way too many antibiotics at it. So there's a lot of things that can come out from this, and ultimately it comes down to your lab and your decision on how you want to incorporate these names or not incorporate these names. And as I said, they've been trying to push it for 10 years, and I'm not sure, is anybody currently using these alternate names in their labs? A little, so that's how you knew the Garada one, right? Knew the Cruzii name. Yeah, so these ones are really difficult, and you have to decide for yourself whether or not you want to incorporate them. All right, we have come to the end of our game. Are you guys ready to see who our winners were? All right, it's going to give us the podium, our top three. So first and third place, we have Morganella. In second place, Roadrunner. And in first place, drum roll with one hand, Jabba the Hutt. Congratulations. Will Jabba the Hutt please come forward for your prize? Awesome. For you, we have a State Lab backpack. Thanks so much for participating, everybody. I hope you guys had fun.